We have a responsibility to take care of our children. Not just my children, not just children with means and with, abilities and resources, but all of the children in our midst.
We always want to do more. We always want to go the extra mile.
If you see the faces that come through this office, we don't only consider them children who are in need. I personally take them or consider them as my child coming through that door who needs the help and the assistance.
If there was a situation where we didn't have a primary care clinic, where we didn't have school nurses, where we didn't have a Young and Healthy, in a community like this where we're used to having it, that's when I think the impact of what we have would really show.
The problem in search of a solution tonight is too many American children who, for one reason or another, are not covered by health insurance. Nearly 10 million American children. Nearly 10 million whose parents work and pay taxes but do not make enough. Which is why we were very taken by what we found in Pasadena, California.
If they would only see the need of the families out there, and these wonderful doctors are able to provide their service and give it to the child, it's unbelievable.
This little girl and her mom came in, and the mom's like, she needs immunizations so she can go to school. Well, the first time you see Karen, you know there is a problem.
Because we weren't sure really what was going on with Karen at that point. We really didn't have a history of her. We coordinated with the doctor's office, Dr. Canals, in getting her to be seen.
I saw her on sort of a more an emergent basis. She needs some care for right now. She's having a cough, she's got a fever, she doesn't look well, and then she's got this chronic medical problem. And it was a huge learning experience for all of us from, what is this Milroy's disease? What does it mean? How is it affecting her? And then how can we get her the help she needs? In Karen's case, she wasn't able to absorb proteins, and so she was malnourished. Nothing was being absorbed, and so she had very low protein in her blood, and the fluid then sort of goes out into the other tissues, and that was also the case for her arm. And the rest of her is this little thin, malnourished girl who can't get what she needs. And so the theory is to give the right formula, the right protein that can be absorbed, and that's what the plan was when she went home from the hospital. But it wasn't working. It's something that needs to be very fine-tuned, and she was still having some of the same symptoms that her mom had seen before she'd gotten the new formula.
Maria's an amazing woman. I mean, she really, really has come full circle. When I first met Maria, she was very scared. Her daughter was sick, wasn't aware of what was going on. As she began to trust me, she was able to understand we're only here to help her and Karen get through this. She has done remarkable with Karen's care. I mean, Karen is now home because of Maria.
We do have families that, for one reason or the other, lose their job, lose their coverage, or they move from place to place, and their coverage lapses for whatever reason. Young and Healthy picks up the slack.
The I Think I Can program is a resiliency program, and it's kind of a tool to help children know a little bit more about how to control their different emotions.
These kids will tell you stuff. It's mind-boggling. And I think, we may be the only ones that are allowing them to talk about this. And that's one of the things that the teachers say too is, wow, she said, I wish they had this when I was growing up.
As a parent, I think we've learned from our parents and their parents, certainly through the generations, that you need another set of eyes to look at your kid and to look at the house situation and the family and the issues that are there and say, you might not be able to see this as hurting your child or not being addressed in your family, but it certainly should be. And Young and Healthy would, their mental health aspect actually would put a finger on that. I thought it was brilliant, and that's why I ended up calling them and saying your program is really great.
From day one, Young and Healthy has done this really well. They've made sure that when there was a child who needed care, they picked them up at their house, they came with their parents, they got them to see you, and they got the care they needed.
It just feels good to be able to comfort someone and provide something that they didn't even know existed and almost didn't even hope for.
Thank you very much for this organization.